I think one of the key problems that we haven't really talked about yet is having that identity type thing. You don't have a national patient identifier, so any kind of blockchain use is going to be somewhat limited in scope. You can't have a national blockchain unless you can uniquely identify patients. The Netherlands, for example, has these little smart cards that everybody has, which is actually a pretty user-friendly way to have public-private key encryption done. But I don't think you're ever going to get that done in America, so I'm kind of pessimistic about it.
Okay.
The other interesting thing on basically tying the patient to a single patient to a unique public key is that chronologically you could potentially, if there was a public chain, you could chronologically potentially identify a patient based on a series of visits, and then extrapolate that forward. So I think there'd also need to be another abstraction layer on top of the identification of a single account or a single patient beyond just their public key, so that you couldn't say, I know that my ex-wife went to the doctor this time, and now I'm going to track her forever forward on that account or something like that.
Yeah, and there's an even bigger problem in my mind. What I would be concerned about as a patient is if you have a master patient identifier that identifies you on a blockchain, a cryptographic key. If you lose that key, there's no way to recover it.
True.
And the hospital doesn't have it, and the hospital can't do anything with your data ever again.
And so
it's permanently lost.
A lot of people that are they're getting around that problem by using is it PGP encryption? So and then what they're doing is they're giving so if you lose your key, you basically say, hey, this person is an authorized user that can verify it's me, and then they would have like access to your key.
Yeah.
So
that's kind of like an idea of a certificate authority that distributes keys, a trusted authority that distributes keys to users. If you lose your key, the trusted authority can give you another one.
Right.
And that's definitely a model that might be very useful in the healthcare industry.